Hi everyone, my name is Dr. Shabri Hassoor. I'm a GP with special interest in diabetes and physician working in the southwest of England. I'm also the medical director of Adisha Health. June 12th till 18th is Diabetes Awareness Week in the UK. Hence, I have done short educational videos to understand this complex disease in simple terms. Today's video is about the pre-diabetes. Day 2 will talk about diabetes. Day 3 will talk about type 2 diabetes, which is the most commonest. Then day 4, we'll talk about type 1 diabetes. Day 5, we will talk about gestational diabetes, which is the diabetes that is seen in pregnancy. Day 6, we will talk about diabetes complications. And day 7, we'll talk about diabetes treatment. So you might ask, Shabri, why we are supposed to, see this video? Well, diabetes is the leading long-term health condition which is affecting the whole world. UK and India is no different. Come, let's look at the next slide, which tells us about the statistics. So how common is diabetes in the UK? 5 million people are known to be living with diabetes in the UK, out of which 4.3 million people know about their diagnosis and 850,000 people are unaware of the diagnosis. 90% of adults who are diagnosed have got type 2 diabetes, and the good news is 90% of the type 2 diabetes is preventable. Now, coming to pre-diabetes. So this is the statistic which really surprised me because 13.6 million people in the UK have got pre-diabetes, or the fancy term for it is non-diabetic hypoglycemia. Now, if you really look at it carefully, it is more than 20% of UK's population. 5 to 10% of the pre-diabetics will become type 2 diabetics if you don't take action year on year. Now coming to the statistics in India, there are 77 million people with diabetes, and it is suspected that 25 million people have got pre-diabetes. So let's talk about diabetes for a few seconds. So the golden organ that you can see in this slide is called pancreas, which is present in the top left corner of your tummy or abdomen. It produces a hormone called insulin, and insulin is responsible to maintain a normal blood sugar. Now, what happens in diabetes is it is a chronic condition where there is high blood sugar because either the body is not producing enough insulin or the produced insulin is not effective, and mainly this is because of developing resistance due to obesity, and in some instances the body doesn't produce insulin at all. So what is pre-diabetes? Pre-diabetes means your blood sugars are higher than normal levels, however not high enough to get a diagnosis of type 2 diabetes. Now, these patients are at higher risk of developing type 2 diabetes. Now, before, as I've mentioned, 5 to 10% of these patients can progress to type 2 diabetes if they don't take any action. So, what are the risk factors? If you are over 40 and a Caucasian, or if you're over 25 and belong to ethnic minority in the UK, if you have got a relative with either pre-diabetes or diabetes, if you have got high blood pressure, or if you're obese, it increases your risk of developing pre-diabetes. So what symptoms these patients can have? The problem is you don't know you have it because you don't have any symptoms. So how do you find out that you have got pre-diabetes? You have to proactively do your risk scoring and find out whether you are at risk of developing pre-diabetes. Now, I have added a link for you to find out your risk. When you do that risk on the website, which is the Diabetes UK one, you will get either moderate risk or high risk. If it comes up as moderate or high risk, you go to your GP and get a blood test. That's how the pre-diabetes is diagnosed. Your GP can do, or your doctor can do, a blood test called HbA1c, which looks at the average blood sugars in the last 3 months. So what treatment options are available? So in the NHS or in the UK, the research has shown that consistently, if anyone combines the healthy lifestyle, which includes diet, physical activity, and sustained weight loss, it can reduce their risk of developing pre-diabetes and later on type 2 diabetes. If your GP, when they do the blood test, they can confirm the diagnosis of prediabetes, they can refer you to a free program called NHS Diabetes Prevention Program. And my advice to all of you is, if you do find out that you're prediabetes, please have a HbA1c blood test every year. So just to reinforce that, proactively know your risk. Get a blood test done. If you are pre-diabetic, please get a referral to NHS Diabetes Prevention Program. A little bit about the program. NHS Diabetes Prevention Program is a nationwide prevention program, which is a joint venture between NHS England, Public Health England and Diabetes UK, where if the GP practices identify the patients who are registered with them are pre-diabetics, they can refer these patients into this free program. Now, these are the resources. The next slide, it tells you about the resources where you can get more information. Now, take home message is, be aware of the risk factors for developing pre-diabetes or type 2 diabetes. Proactively do your risk score. If your risk score is moderate or high, get a blood test done. If that confirms pre-diabetes, get a referral to the NHS Diabetes Prevention Program. Start, maintain, or intensify your healthy lifestyle measures in terms of diet, physical exercise, and maintaining an optimal weight. And annually get a blood test done. I've been fortunate to be the clinical lead of NHS Diabetes Prevention Program for the Gloucestershire CCG since the last 6 years, and I've done some really good work around it. Thank you for listening, and be ready to learn about diabetes tomorrow.